So my own experience in healthcare inequality um, kind of like has dogged me over the years, and I remember as far back as while I was working as a certified nursing assistant and attending school, the time I had dental insurance, but it barely covered the cost of essential work, let alone cover any significant treatment. After I fell out of immigration status, I lost completely all access to most forms of healthcare, including dental. And over the years, I simply couldn't afford the care I needed, and there was no safety nets available for people like me. During COVID-19 pandemic, I was working and as usual under the table, and I didn't have the privilege to stay at home for my safety. I remember I was literally worried that we would shut down business because how would I pay my rent? My mortgage, it was due. Um, my car note, it's due. There's no reprieve, that or access to government stipends as they were giving out. I never had access to those kind of stuff. So I was scared, vulnerable, and uninsured. I thank God that over the years I've never had any serious medical issues, but the fear of getting sick and not being able to afford care was always present. This experience made it clear to me that healthcare access is a privilege in America and not a right. Um, Healthcare inequality in my community, I've witnessed people, especially immigrants and low income families, struggle with access to affordable healthcare. Even basic care like dental visits or mental health services are often out of reach. Many people wait until something critical, something becomes an emergency to seek treatment because they simply can't afford preventive care. Language barriers, immigration status, lack of insurance, and mistrust of the system all play a role in creating these gaps. There is also a noticeable shortage of providers in these are underserved areas, especially providers who reflect the cultural and linguistic diversity of the communities they serve. So, responsibilities in healthcare communication. So, both patient and health workers have an important role in communication. As patients, we should do our best to share information honestly, ask questions, and advocate for ourselves, even though that can be intimidating when the system isn't built to support us. But more importantly, healthcare workers must lead the way in creating safe, inclusive, and respectful spaces. They need to be trained in cultural competence, avoid assumptions, and make an effort to truly listen. As Dr. William pointed out in the video, equity is not about giving everyone the same, but about giving people what they need to reach their full health potential. All right, thank you.